Hello, my name is Amit, and I'm one of the research fellows at VOTR, a nonpartisan, nonprofit organization that aims to reduce barriers to civic participation by helping patients register to vote while in healthcare settings. Today, I will be presenting my abstract called Promoting Civic Health Through Patient Voter Registration. Previous studies have shown an association between health and voting enables populations to support policies that ultimately impact their health. For example, factors such as income, education, housing, and healthcare access all play vital roles in a person's healthcare landscape. However, many barriers exist which disproportionately affect the civic participation of certain minority groups. In our country, voters have to register themselves to vote, unlike other countries across the globe, which serves as one of many barriers to people from certain minority and ethnic groups and lower socioeconomic backgrounds to make their voices heard. Social and political scientist Dr. Javier Rodriguez found that 2.7 million excess Black deaths led to a loss of 1 million Black votes in the 2004 elections, which is just one of many examples of the feedback cycle between population health and politics that perpetuates inequities present in our society. The graph on the bottom left shows how the percentage of registered US citizens drops from white citizens to Black and Asian citizens. Likewise, as the highest degree earned drops, the percentage of registered US citizens also drops. In 1993, the National Voter Registration Act, which applies to 44 states and Washington, D.C., allowed hospitals to provide nonpartisan voter registration information and allow patients to register on site, alongside normalizing DMVs as sites of voter registration. But how exactly do healthcare providers fit into this role? At VOTR, we believe that a crucial part of this work relies on normalizing conversations about civic health between healthcare providers and patients with the goal of closing the civic engagement gap. At the start, before the COVID-19 pandemic, we had set up iPad-based kiosks in emergency department waiting rooms, allowing patients to register themselves to vote while waiting. However, once the pandemic struck, we expanded our touchless digital approaches. We provided healthcare workers with healthy democracy kits consisting of badge backers, posters, discharge paperwork, and other resources. These contain QR and text codes that direct users to an online platform for registering to vote or to request a mail-in ballot, which was present in both Spanish and English. Links for checking and updating registration status can easily be shared through telemedicine visits. Hospitals and clinics can also perform SMS and email outreach to their patients with key voting information. Also, between July and October of 2020, we held a Healthy Democracy campaign, which involved 80 med schools across the US. Med school teams urged students and healthcare workers to use their HDK resources to ask patients about their plans to vote and vote safely during a pandemic. The map here shows the geographic distribution of participating med schools across the US. The HDC helped prepare nearly 16,000 people to vote in the span of about 2.5 months. In total, though, from May to November of 2020, we helped prepare 46,320 people to vote, and 13,192 individual healthcare providers across all 50 states signed up for and received their healthy democracy kits. In sum, we believe that a healthy democracy is one in which all individuals have the opportunity for their voices to be heard. Voting has both direct and indirect associations with health, and when people from all ethnic, racial, and socioeconomic backgrounds are able to voice their opinions, we believe that our healthcare system is both stronger and more equal. Thank you so much.